and get ahead, and that is a crying shame. Mr Deputy Speaker, I also want to deal with the issue of healthcare, and in this case, the cost of seeing general practitioners. And according to figures provided by the Department of Health, in my electorate of Greenway alone, out-of-pocket costs to see a GP have increased 39% since 2013. So that figure alone is large. But when you consider it in the context of all those other economic indicators that I mentioned, it is absolutely staggering. Out-of-pocket costs, specialist costs, have risen even more, up 42% in the same period. Now, what does that mean? We're talking in monetary terms about an average cost of $94.59 to see a specialist, and that's up from $66.65 since 2013. And it is staggering too that only 29.9% of people in Greenway are bulk billed by specialists. So what we're seeing is thousands of local residents being slugged with higher costs each and every year. Now, Mr Deputy Speaker, I'm a great believer in primary health care. In one of my previous lives, I had the privilege of serving on the board of the Western Sydney Area Health Service, and it was there from very great minds that I learnt the basics, but certainly it was a real insight into the economics of health. And one thing that always stayed with me was being told about the importance of primary health care. And it's something I never forgot, but something I did not fully appreciate until I came to this place, and saw what this government was inflicting upon Australians and the impact that it will have. And I make this from a very personal point of view, Mr Deputy Speaker, and that is that around 6 years ago, I went to see my GP, whom I had been seeing for a number of years, and I hadn't been feeling too well for a while. So he did a few tests, and he basically said to me that I needed to do something really drastic with my health, really drastic from a proclivity towards a potential to have cancer as a result of family cancer history, but also diabetes, again as a result of family history of diabetes, and also heart disease as well. So I needed to do a number of things, and for me this was very radical. And it was not a plan that I thought I could put in place. I was a relatively new mother still, busy job, busy with my day-to-day life and my family. But I decided to take on his advice. I was put on a care plan. I had referrals to a number of specialists. Now, Mr Deputy Speaker, because I am of means, I am educated, and because I took on board that advice, I was able to implement the plan that my GP set out for me. And as a result today, I'm actually far healthier than I was 6 years ago. But I make this point, Mr Deputy Speaker, because I believe we need to not only cherish our general practitioners, but we need to promote primary health care much more than we do in Australia. And the unfortunate reality is that record costs of healthcare means that many Australians skip seeing their GP, and we have a system that's set up for episodic or one-off care rather than that long-term care. The alternative, of course, is to only see a GP or a specialist when things go wrong and to fix it there and then, not a long-term plan for prevention, and certainly not a plan that enables you to address what can become potentially chronic disease and become even more expensive to treat. And in my area alone, Western Sydney is known as the diabetes capital of Australia, most unfortunately. Coronary disease, smoking rates are still too high. I firmly believe that this requires a different model of care. It needs to be ongoing, it needs to be comprehensive, and it needs to address all of those health issues in a very integrated way across health professionals. Now, I understand, Mr Deputy Speaker, even speaking to my own GP and the specialists to whom he's referred me, they want to practice in this way. They want this new model of care. But instead what we've seen is the freezing of GP payments as this government has done for 4 years. And unfortunately, it's that kind of backward-thinking attitude that is not going to address these crises in healthcare, particularly in Western Sydney, which has some of those most chronic conditions, as I mentioned.